Fat grafting to the face is one of the more revolutionary concepts and techniques that we've done over the past 10 years for facial rejuvenation. And I'm going to tell you where the most common areas are for your facelift or neck lift. So if we're talking about the face, we'll start at the upper third, the temporal area right here. Sometimes you have an indentation there. That's called temporal hollowing. That is a sign of aging. So if you have it, typically it's not aesthetically pleasing and we can fill in that area with fat. An area that's very common is the lower eyelid. I have to carefully prepare fat and place a tiny amount right here in this fold, the tear trough ligament, the nasal jugal groove, this upside down C-shaped thing. So the reason why is, of course, you usually have bags under your eyes, but part of that reason is because you have a ligament, the orbital malar ligament, that is preventing the fat to sort of equally disperse and drop. So if we fill in this area just above that ligament with fat and with your own fat, it smooths out the lower eyelid cheek junction and gives you a more rejuvenated look. The upper eyelid is a less common area for fat grafting, but if you have noticeably hollow upper eyes, that is an option for you. Going to the cheek, yes, as we age, our fat that used to be nice and plump and round and sort of around our cheeks, that fat flattens and drops down. So to prevent that, we can actually rejuvenate the area with fat. During a facelift, I have to lift up that cheek fat and I have to bring it back to its original position. But most patients still lack really enough fat there and it has to be augmented. So I could do fat grafting to the cheek and to the cheekbones. In other words, the cheek and the area just to the side to give you a more youthful look. For the lower third of the face and the jawline, typically just doing a facelift neck lift to rejuvenate the jawline is enough. However, in the neck, if you have deep horizontal wrinkles, I can rejuvenate that area with fat. That's a less common procedure, but definitely some patients need it. Another option is if you have what we call a weak chin, a weak jawline, or you're pretty thin and it's still not looking the best after my surgical procedure in the operating room, we can augment the chin, the angle of the mandible, this angle L-shaped thing right here, and the jawline with a little fat. That definitely helps in certain patients, and again, less common, but it's definitely an option for you. Finally, a very uncommon procedure, but one that is increasing popularity, is the forehead. So people have definitely noticed that as we age, the forehead actually flattens on profile and doesn't look quite as round. So if you notice that in your face it becomes very flat, we can carefully place fat right around here to give you a more youthful appearance, not necessarily making it very round, but it definitely helps. So I hope you found this video interesting in terms of common and less common areas of fat grafting to the face. If you have any questions, concerns, want me to talk about something else, please let me know in the comments below. Thanks so much for watching.